Hello, good evening, everyone. My name is Lee Ann Lazarus, and I am the eye screening manager for the Trinidad Eye Hospital. I am also a certified retinal screener with over a decade of experience, and I want to welcome you to today's live discussion. We are focusing on blindness and eye disease, what's avoidable and what's not. This conversation happens just in time for World Sight Day, which is tomorrow, a day that we acknowledge and appreciate our vision. Let me introduce our panelists. So we have Dr. Vachel Luces. He is a Trinidadian born consultant ophthalmologist with over 15 years of experience in eye care, a graduate of the University of the West Indies and a fellow of the Royal College of Physicians and Surgeons in Glasgow. He's skilled in cataract, pterygium, and glaucoma surgeries and is part of the expert team at the Trinidad Eye Hospital. Welcome, Dr. Lucis. We also have Josiah Ambris. He is an optometrist at TEH Optical who specializes in early detection and prevention, helping patients take proactive steps to protect their vision. Today, we'll explore the major causes of blindness, which conditions are avoidable or reversible, and why early detection is so critical. So let's get started. So, Dr. Luces, my first question is for you. So, can you give us an overview of the leading causes of blindness both globally and locally in Trinidad and Tobago?
Good evening, Leanne. It's a pleasure to be here, and thank you for having me.
Thank you.
So, globally, in terms of the leading most common causes of blindness, it's a lot of what we are familiar with and
Hmm.
hear about commonly, starting with refractive errors. And what that basically means is that for some reason, our eye is not able to focus well enough to give us distance vision or near vision to look at things far and to look at things close.
Hmm.
Another major cause is cataracts. This is where the lens or the window in through which we look at everything in the outside world becomes cloudy, so our vision isn't clear anymore. Another major cause is glaucoma. Now, glaucoma is different in terms of the pressure in our eyes becoming elevated higher than it should be, and it damages the nerve in the back of the eye, which then leads to loss of vision. And another common cause that is increasing in recent years is diabetic retinopathy, which essentially means that the diabetes, those who are diabetic, it affects the eye and it affects the circulation, especially in the back of the eye, which leads to many complications that can cause a patient to lose vision.
Hmm.
So worldwide, these are the most common causes. And in our country, Trinidad and Tobago, it pretty much reflects the same pattern. And I would say some of the commonest and most important to focus on would be cataracts, glaucoma, and diabetic complications affecting the eyes.
Okay. Thank you so much for that explanation. And Dr. Lucis, in your opinion, do you think that the ordinary Trinidadian has any real concept or idea of these diseases or are fully aware of their existence?
Not enough of
Mm-hmm.
our general population knows the basics of these conditions,
Yeah.
understands how they work,
Mm-hmm.
and the importance of how they are treated as well.
Yes.
It's very easy that most of us have heard those words before,
Mm-hmm.
cataract, glaucoma,
Mm-hmm.
right? Or bleeding in the eyes. But very often when I interact with patients, and I give them a diagnosis of one of those three problems. And I dig a little deeper to get their understanding as well, because I always feel that we as doctors, or we as eye care professionals, we will assess patients, we will diagnose problems, but it's also important for the person to understand what's happening with their eyes. And
Mhm.
very often, people may not have a deep enough understanding of how these problems work.
Yeah.
So I think that as eye care professionals, we certainly have a job to do in getting the wider population to know more and understand these problems because they're so common and they're so
Yeah.
important.
Yeah, I definitely agree. Going out into the community, we take a lot of effort to educate. So I think that's very, very true. It plays a big part in people being aware of what's going on. So Josiah, I'm gonna turn to you now. Um, from your perspective, from the optometry perspective, what are some of the conditions that you see that could lead to blindness if not detected early?
So some of the conditions we will be looking at will be all for the major preventable causes. So cataracts, glaucoma, diabetes. Now, when patients do come to us, they will present with some will present with signs and symptoms, others will just present with signs and be asymptomatic. And it will
Mm-hmm.
be our job to highlight these different things. So some patients may come complaining of floaters in the eyes if left untreated. It could be detrimental to the eye, depending on
Right,
what's causing the floaters. Also, some might come complaining about blurry vision when looking into the eye. It could be either a cause of cataract or visual impairment, as Dr. Lucas was saying earlier, refractive error. So
right.
something simple will always be there to correct or prevent further vision loss. So we
Yeah.
always look for the signs and the symptoms.
Okay. And in terms of what you see, would you say that people are proactive when they notice these changes, or they tend to wait until it reaches a point that it's not so easily manageable for them?
So usually when the changes now occur, it will
Hmm.
not really affect your functional vision. So
Yeah,
most times they wouldn't really want to come in. They think they're seeing fine and that's it.
yeah,
Um, Usually until they reach the mid stage of a disease progression or where it actually affecting their quality of life, that's where they actually want to come in to be seen.
yeah,
At
right.
that stage, we could still do something about the eyes and everything, but as we say, early detection is always better than the cure. It's
Correct.
just prevention we're looking at.
Yes, we want them early. All right. So let's talk about what diseases can be treated or prevented or unfortunately are irreversible. Are there any unifying themes of vision loss, Dr. Luces?
Sorry, could you repeat one more time?
Sure. So I asked, we're going to talk a little bit about conditions that can be treated, prevented, or are irreversible. So I wanted to know if there are any unifying themes in terms of vision loss. What are the normal symptoms and signs that we see people complaining about? And what are the usual presentations in terms of clinically?
So interesting. The presentations or the way in which people experience these common eye problems varies a lot.
Mm-hmm.
It varies from the person who has really cloudy vision that they can't function
Yeah,
to someone who is surprised that you are giving them a diagnosis because they thought they were seeing fine and everything was okay.
yeah,
Right? But the overall theme is a reduction in the vision. For
mm-hmm.
some reason, the first thing a person will notice is that I'm not seeing how I usually do,
Yeah,
generally. And that usually involves the central vision. So when they're looking at something, say watching TV or reading, or some people also describe that when they're on the street and someone familiar is walking towards them, they can't recognize that person. These are
yeah,
pretty common, and these are often how it starts. especially when it in terms of cataracts. As cataracts progress, these are the kind of symptoms that patients can notice.
Mm-hmm.
Diabetic eye disease can be similar,
Mm-hmm.
but you can also get additional problems like floaters, particularly if someone has bleeding inside of the eye. They may actually tell you, I'm seeing some dark or some red spots moving around inside of my eye. So I know something is wrong. And very
Right.
often, these diabetic patients know that their eyes are bleeding before we, as the eye care professional, look into their eyes.
Mm-hmm.
But glaucoma is a very interesting one because most of the patients I diagnose with glaucoma have no symptoms.
Yeah.
There's a reason why glaucoma is called the silent thief of sight.
Mm-hmm.
And the reason why it's silent is because glaucoma damages someone's peripheral vision first.
Yeah.
So the peripheral vision is your side vision. If we are looking directly at something, say we're watching television in a room,
Mm-hmm.
we are still able to see if someone is walking across to one side of us. That's our peripheral vision working for us. And
Right.
also, we use it without even realizing that we're using it. For example, when we're walking. Most of the times when we're walking, we're not necessarily looking straight at the ground, but some part of our peripheral vision is seeing what's
Mm-hmm.
happening on the ground. So if there was a pothole, you better
Yeah.
believe even though your head isn't down, you're not
Mm-hmm.
going to walk into it because your peripheral vision will see it.
Right.
So sometimes in the early stages of glaucoma, patients may notice subtle changes like that, but most people I've found don't notice when their peripheral vision goes.
Right.
So they don't notice any symptoms in the early stages of glaucoma.
Mm-hmm.
And then by the time they notice the vision is affected, the glaucoma is much more advanced and much more difficult to treat as well.
Right.
So that is a very interesting point. There's a lot of variation in whether or not the person themselves will be able to tell there's a problem or not.
Right. And that variation also makes it important to screen because you never know what's going on in the back of your eyes. So it's
Exactly.
always important to get that check done. So thank you, Dr. Lucis. All right. So Josiah, um, what do you usually find during screenings when you're looking at patients? So when you're looking at patients in different stages of disease, what do you usually see when you look when you're doing your exams?
So the first thing we will do, or just to touch base on what Dr. Lucas was saying as well,
Sure.
the first thing we will do is monitor the vision loss, meaning
Mm-hmm.
if it's progressive or if it's stable, depending on if it's progressive or not, we'll be able to do further checks to the back of the eye. Um, and the front of the eye, of course, to determine was it cause or was it signs for asymptomatic patients. So, in an instance for glaucoma, where the patient don't necessarily notice that the peripheral vision is gone, when they actually come to us, we could do visual field testing to determine
Right.
any early changes that might be happening with respect to the eyes. For patients, particularly with diabetes, something as simple as checking your blood sugar level or some form of instability in the prescription could be an
Mm-hmm.
indicator that you're diabetic. Just simple
Right.
things like this could indicate us that, hey, you need to go and get your blood sugar checked out if you already have not done that. And if
Yeah.
that's the case, you didn't do your blood sugar and you know you're diabetic, then you need to control it. Just controlling it alone can stop early stages from progressing. And
Mm-hmm.
that's basically what we're looking for, the signs of the asymptomatic patients. Yeah,
Okay. Thank you, Josiah.
no problem.
And just to expand on something Josiah said that I agree with, is diabetics is an example.
Mm-hmm.
I have, and this may come as a surprise, but I have sometimes diagnosed people with diabetes. just
Yeah,
by looking at the eyes.
we see it in screening. Yeah.
That's right. Sometimes the patient doesn't realize that they're
Yeah.
diabetic. They've never had regular follow-up with a doctor,
Mm-hmm.
and they happen to get an eye exam, and we as eye care professionals see the signs
Yeah.
of it. And
Yeah.
later on, send them for testing, and then they realize, yes, I didn't know that I was diabetic.
Yeah.
So the eye examination can give us so much information that the patient themselves wouldn't be able to pick up on if they
Right.
didn't come for that assessment.
Yeah. I'm sure Josiah sees that as well. I'm seeing him shaking his head. So I'm sure he sees it as well. All right. So, Josiah, I have a question for you again. What would you say are the common misconceptions patients have in terms of eye care and their vision?
So the first thing patients will do is try and eliminate themselves from having a problem. So they will say, I don't have a problem. My eye is good. I don't need no eye test. That's the
Right.
first thing the patient will come to say. Well, in general, you never really know you have a problem unless you actually do a check. You know, it
Right.
already what's going on inside the body unless you do the correct assessments. From the time signs starting to be shown is a bit too late in terms of
Mm-hmm.
the prevention part. You're not looking at curing or treatment or management, right?
Mm-hmm.
So that's one thing. They will say something like, for preventative measures such as cataract, we will do cataract surgery. They will find that a bit too risky, so they will look into deterring the ambitions towards that. In terms of the vision loss, if they do see their vision loss happening, they still want to come in once it's not affecting the quality of life. So
Right.
you shouldn't wait for the vision loss to affect your functionality and stuff. It should come in prior to that. So
Yeah.
how to put it, trivial thinking of the ophthalmic will should be diminished
Yeah.
because a simple eye test just come in
Yeah.
20 to 25 minutes. A simple eye test could detect a lot.
Mm-hmm. Definitely agree. Dr. Lucis, you wanted to add anything to what Josiah said?
Now, he made some excellent points there.
Mm-hmm.
Um, what we're arriving at the common theme is that have your eyes checked.
Mm-hmm.
You're going to find out so much more information than if you don't come in.
True.
And for many of these eye conditions, the earlier we pick up on the signs and start taking steps
Mm-hmm.
is the better.
Yes.
And it really gives you better long-term vision.
Yes, definitely. All right. So we're going to take some questions from the audience. So let me just see what we have here for you. All right. So Dr. Lucis, we have a question for you. Can children develop glaucoma or cataracts?
Absolutely, yes.
Mm-hmm.
This is a surprise to a lot of people when we say yes, but it's true.
Yes.
Some children are even born with cataracts or
Mm-hmm.
born with glaucoma. From the first month of life, they have to
Yeah.
start getting assessments and getting treatments. Now, these are relatively rare. However, still during the course of childhood, children can develop cataracts for various reasons. Sometimes there may be a general medical condition that predisposes that child to
Right.
developing a cataract. Sometimes a child may have an injury to the eye. And
Mm-hmm.
just like adults who get injuries to the eyes and then develop cataracts afterwards, the same can happen with children as well. So, yes, on that point, and yes to glaucoma as well.
Yeah.
Most people think of glaucoma as a condition that starts in older adults,
Mm-hmm.
generally over the age of 40. And while it's true that a majority of our glaucoma patients tend to be of that age, we have still seen an alarming number of children
Yeah.
present with the signs of glaucoma and
Yeah.
have been diagnosed with glaucoma
Mm-hmm.
and needed to be treated with glaucoma. And this is critical to know because glaucoma is dangerous because out of all the conditions we'll be speaking about tonight, glaucoma is probably the most irreversible,
Yeah.
truly irreversible eye problem.
Mm-hmm.
And once you only have a short window of opportunity to diagnose and start treating glaucoma to stop it from causing blindness,
Right.
permanent blindness. And in children, this is more critical because they need to have their vision for the rest of their life. And the rest of their life is probably 60, 70 years.
Yeah.
So it's a long time. And glaucoma can sometimes take away your vision in less than 5 years
Mm.
without treatment.
Right.
So it's definitely important to know and understand that yes, children can have cataracts and glaucoma. So it's
Mm-hmm.
important for them to have regular eye assessments as well, so that
Right.
these things can be picked up on and we can protect children's vision for their life ahead of them.
Thank you, Dr. Luces. So, Josiah, often with kids, the first eye check they have is probably a glasses assessment. How often do you think children should have their eyes tested?
Generally, children should have their eyes tested every year, given that they don't have any other ocular abnormalities or any other ocular progression in the eye. Every year is fine. Um, for older folks who present with diabetes, hypertension, or comorbidities that is uncontrolled every 9 to 6 months, for those who more in the working class in their 40s and so forth, they
Mm-hmm.
should do a eye test every year because they're at risk of what we call presbyopia. And then they also should be proactive in terms of checking for any family history of comorbidities because
Right.
that's where the risk is increased at these ages, 40 and onwards.
Yeah.
So these are the small things that they should take part in.
Do
To
you
help.
usually find that people are aware of their family history? Because when we do it in screening, they usually have no idea.
Yeah, no idea at all.
Yeah.
So that's the main point there. Once you're
Yeah.
totally unaware of your family issue, you should be proactive and go and
Yeah.
check out yourself, see what levels you are with respect to your health status.
Definitely agree. So, Dr. Lucis, a question for you again. Is a good diet and exercise enough to help prevent eye disease?
It helps, but in isolation, it's probably not enough. There are some conditions in the eye where diet in particular can be beneficial.
Mm-hmm.
So, a diet high in antioxidants, for instance, can slow down the progression of cataracts, and that's critical.
Mm-hmm.
And a diet high in antioxidants would include fruits, vegetables, especially yellow or orange vegetables like carrots, pumpkin, green leafy vegetables, things like spinach, broccoli can be
Right.
beneficial as well. Fish with omega-3 like salmon, tuna, and even nuts such as almonds. These are a few things that can actually contribute or slow down the progression of things like cataracts. So there is some benefit there. And when we talk about diabetic retinopathy as another cause of vision loss, diet has an important role to play there too, diet and exercise, because by
Right.
far, not every diabetic will get diabetic retinopathy. So,
Mm-hmm.
what are the factors that contribute to a diabetic getting complications in their eyes? Well, of course, this blood sugar control is a big part of that. So, if your sugars are very elevated, out of
Mm-hmm.
control, you are more at risk for getting complications in the eyes. And diet and exercise can have an important role in getting better control of your blood sugars, which in turn gives you protection for the eyes. However, while it has this role, there are a lot of other factors that can still contribute to cataracts, diabetic problems, and even things like glaucoma
Mm-hmm.
contributing to vision loss.
Right.
So diet and exercise helps, but on its own isn't quite enough.
Okay. Thank you, Dr. Luces. So we have a question here as well. Um, what treatment is there for wavy eyes? I'm assuming they're seeing wavy. They wanted to know
Right.
what would be the treatment for that.
So what that sounds like is that their vision is
Mm-hmm.
distorted.
Mm-hmm.
And there are a few things, different conditions that may contribute to someone
Right.
having vision like that.
Mm-hmm.
Probably most commonly is a problem with the retina. The retina is the lining of nerves on the inside of the eye that's important for our vision. And
Mm-hmm.
there are some problems that can affect that part of the eye and give distorted vision. Other parts of the eye may contribute to that as well. Cataract may present in that way. Problems in the front part of the eye, such as cornea, perhaps with astigmatism, can contribute to wavy vision as well.
Mm-hmm.
So the truth is that there is no one answer to that question because it would really depend on what's causing the wavy vision. And
Right.
then the treatment would have to target what the cause of the problem is. And of course,
Okay.
the only way to differentiate what the cause might be is to actually have an eye examination with an eye care professional.
Okay. And Josiah, we have a question here for you. Can floaters lead to further eye issues?
Yeah, if left untreated, floaters could lead to further eye issues. Floaters is just a sign of many different eye conditions. So once the sign is there, you need to come in first to detect what is the cause. And as Dr. Lucer said, the treatment will follow the cause. It can't
Right.
just treat anything for anything.
So I'd
Thank you.
like to expand on that one.
Sure.
Floaters is a potentially urgent one.
Right.
So some of the other things we spoke about, decreased vision, blurry vision, and so, yes, while it's important to get those assessed, maybe you think you get that assessed within a week's time or
Mm-hmm.
within 2 weeks' time, depending
Yeah.
on what your schedule is like. But
Yes.
floaters is something that you really want to get assessed the same day if possible,
Okay.
because I agree with Josiah that there are many different causes of floaters. But one important cause of floaters can be a detachment of the retina. And that's an urgent problem that might require
Yes.
urgent treatment within less than a week treatment to
Right.
give you the best chance of recovering your vision. So that's an important
Mm-hmm.
one, actually, because everyone should know that floaters and also seeing flashing lights in the eye Those are
Yeah,
two reasons to not just have your eyes checked, but to have them checked as soon as possible.
definitely agree. Thank you, Dr. Lucis. So, as we wrap up, a few key reminders. Tomorrow is Will Sight Day. We will be conducting free screenings at certified Scoops locations at South Park and Eastgate Mall. And our community screenings continue throughout October and as well as selected schools throughout the month. Our optical branch is also celebrating its anniversary this month. So it's a great time to check out your eyes and benefit from their special offers. Remember that screenings are quick, painless, and they can literally save your eyesight. So, Dr. Lucis, I'm just going to turn to you for some closing remarks.
So it's been a pleasure participating and imparting information that's important to the general public to know about
Yeah.
how to protect their eyesight. And I really think the key is to pay attention to those common conditions. Diabetics need to pay attention. Anyone who has a family history of glaucoma, pay particular attention. And anyone over the age of 40, which is where these eye conditions tend to be more common, should definitely pay more attention to their symptoms and don't write off any change in the vision as being harmless.
Yeah.
The key is get to an eye care
Yes.
professional and have your eyes checked as soon as you can, because what you might think is simple or harmless may actually be dangerous, but
Mhm.
if detected early, can save your vision.
Yeah, definitely agree. Thank you, Dr. Lucis. Josiah, turning to you for your closing remarks now. You mute.
Yes. So for the patients out there, you always want to be proactive in what you do. You always want to go and get your systemic body checked out for any comorbidities. You want to eat healthy, exercise, keep a good diet in you, so that way whatever is in you could also come out good. You eat good, you produce good stuff, so you'll see good as well.
Mhm.
Yeah.
Thank you, Josiah. So I want to thank you both for giving us your time and your wisdom. I really appreciate you all diving into the subject area. I just want to leave everyone with the knowledge that you have one life to live. We want you to enjoy it, being proactive, being aware of your family history, paying attention to what is going on in your body. We emphasize that at Trinidad Eye Hospital. We want you to see the world around you and enjoy it. So I want to thank everyone for joining. Thank you, Dr. Lucis. Thank you, Josiah, and have a good evening, everyone.